Give me 1 second. Yes, Faria, go ahead.
Yeah, sir, I published the module. Is it showing for the student?
Okay, Carmen, could you please check or just refresh your site and just tell us whether are you able to see or not?
Yes, we can see.
Okay, good.
It's
Okay,
good.
good.
Okay.
Thank you.
Thank
Thank
you,
you,
sir.
Faria. Thank you.
No problem. Bye.
So the restorative materials, these are the name which is most commonly used nowadays. Amalgam, which is also known as, the silver filling. Some people say the metal filling. Some people say the mercury filling because it contains mercury. That's why people say mercury filling. It contains silver. That's is called the silver filling. So silver filling, metal filling, mercury filling, amalgam, these are all the alternative name. Composite resin filling materials. Nowadays, you will see the people are conscious about their aesthetics. So it is very, the very commonly we use people, they don't want to show their tooth to be come up with the metal filling. So we call them the color match. So tooth color match filling is known as composite filling. Glass ionomer also same, which is also tooth color match. Restorative, temporary restorative materials, which we give for 7 days or 2 weeks or 3 weeks. Then we can replace it with the permanent restorations. Gold alloy, people are also use gold for the restorations, but now it is very rare because people sometimes go to the graveyard and they take out the dead body and they get the gold from there. So that's the reason it is gradually decreased. But previously it was used as a what do you call like the restoration or restorative materials. Ceramic materials with a combination of metal and non-metallic structures such as the porcelain, zirconia. These are the examples of ceramic casting materials. We'll talk about the ceramic casting later in these presentations. As you can see here, these are some examples showing you that what are the restoration look like. So if you see that the amalgams, they look like metals, or you can see silver color metals, we can see here. These are the composite filling materials. It looks like there is no filling, but there is filling because they are tooth color match. It matches the color. Now, there will be another one that is called the glass ionomer materials. Now, one of the big advantage that is very, very important, it can be MCQ questions. So, the color match materials like glass ionomer, it is a restorative materials or luting cements. It can be used for the gluing purposes of the indirect restorations, and it releases the fluoride. It releases fluoride. That's why it is very important. There is the only one materials in dentistry which release the fluoride, and that is glass ionomer. Question become like that: which of the following restorative materials release fluoride? That is answer is glass ionomer, or in short we call them the GI. Then the next is here the temporary restorations. As I mentioned, the temporary restorations, also known as CAVIT, that is a commercial name for these materials. So these materials we use for temporary purposes. Say a patient come with hypersensitivity or the deep caries, we just apply the temporary materials to see the patient's conditions, whether the pain is subsided or not. Then finally, we go for the final restoration on the top of this. Just we take out a little bit, keep the base, and then on the top of the base, we go for the final restorations. That is called the temporary restorations. Then gold alloys, crowns, inlays, and onlays. Inlays and onlays, these are also known as indirect restorations. So they will be covered the entire occlusal surface, that we call them the onlay. And when they covered the small portion of the occlusal surface, the posterior teeth, we call them the inlay. And it can be made by gold, or it can be made by the ceramic, or it can be made by the, the what do you call it, porcelain or color match ceramics. So these two are the pretty much same. These are all known as indirect restorations. So as you can see here, these, and these, like means amalgam, composite, glass ionomer, and the temporary restorations or IRM, they're all about the direct restorations. But in order to make a gold restorations or ceramic restorations, by using the gold or by using the porcelain, zirconia, ceramics, then in that case, we need to go for the laboratory support. And that will take time. And that's why it is known as indirect restorations. Talk about this one, which is about the standardized dental materials. What will be a standard dental materials? We want the materials which we put in our body because materials we give into the oral cavity. Oral cavity, it is a part of the body too. So we should not put anything inside our mouth which is create harmful effect to our body, right? So that's why it should not be poisonous and it should not be harmful to our body. That means it should not create any reactions to our body once we apply it on the tooth because tooth also a part of our body. It must not be harmful or irritating to the tissue or the oral cavity. It must help to protect the tooth and the tissue in the oral cavity. It is resemble to the natural dentition, that is tooth color match, or closely as possible as so far to be aesthetically pleasant. Okay. Then it must be easily manipulated and easily placed inside the patient's mouth and it must comfort and the functions. So the when we are giving the restorations, we also think about the function also. Like if you give a materials and the patients went out and after restorations, patient went for eating something and then during eating time the feeling is break or coming out, that means it is not fulfill the function, it is not able to bear the load of the masticatory stress. What is the meaning of mastications? Anybody in the class? What is the meaning of mastications?
Chewing.
That's right.
Mastication.
That means when we eat, we also call them the mastications. So once we chew our food, and if the tooth has the restorations, the filling materials, if it is breakout, that means it is not withstand within the masticatory stress. So it should not be like that. So these are the gold standard for a dental materials. So any dental materials, whenever we put, we have to keep in mind that they should be like that. And the manufacturers, when they make these materials, they actually keep in mind that it should not be harmful to the body, harmful to the, nor should not be harmful to the oral cavity, color match, load bearing capability, easily manipulable and easily transferred to the patient's mouth. Say, as for example, we make something, but we are not able to transfer it to the patient's mouth. That type of material we don't want. Or during mixing time, it take lots of preparation. That also we don't need. We want a very simple thing: powder, liquid, mix, and permeable, soft. Give it to the patient's mouth. Once it goes to the patient's mouth, immediately we want them to harden up. That's the one we want. That is actually standardizations of a dental materials. Now, all these materials, when they come in the market, we need to follow their properties. So these properties are very important. And these properties based on in the different types. Dental materials, which is used to restore the teeth, they must respond to withstand the specific factors when withstand specific factors associated with the oral conditions. So what are those withstand with the factors? Such as I mentioned, that it's the capability to withstand the domestic stress, number one. Number two, it should not be soluble. What is the meaning of soluble? Solubility means like it is washed away. So we don't want any materials that is washed away to the saliva because in the oral cavity on the tooth surface, saliva is present. So if we put some materials and saliva is gradually wash out those materials, then that type of materials we don't want, right? So this is the way we have to keep in mind that there are some properties of the dental materials. They actually help us to keep the materials within the oral cavity. What are those characteristics? Mechanical properties, ductility and malleability, thermal changes, electric properties, corrosive properties, solubility, and the application properties. So application properties is very important for us to memorize: solubility, corrosive, electric, and thermal, and also ductility and malleability. Mechanical properties also important to understand about the mechanical stress. So now what are those properties? Let's talk one by one. Mechanical properties. Mechanical properties we can explain in three different ways. One is force, stress, and strain. Force means you are applying some pulling actions or pushing actions, push or pull. When we pull, that is called the force. That means you are applying some forces. That is called the force. Now, stress is the reactions. So once we push or pull, there will be some reactions present within the materials. So the reactions within the materials, and that can cause the distortions. That is called the stress. And the strain is the change, the result of the stress. So change produced within the material that occurs as a result of the stress. So there are three things. One is force, stress, and strain. Force means you are trying to push some pressure on the materials. That is called the force. It can be pulling actions or it can be the pushing actions. So either we can push or pull. This type of action of the materials is known as force. And then once they get the something push and pull, then the materials will react. They will be react. There will be reactions going on in between the materials. And the reactions that is called the distortions. The reaction that can cause the distortion, and that is known as our stress. And the result of the stress will be tell us about the strain. That is called the strain. So materials, they must be able to withstand the biting and the chewing forces in the posterior teeth. That's the reason we have to understand that why the push-pull and stress and the strain are important, because whenever we give the materials in the patient's mouth, they must be able to withstand the biting and the chewing forces. Because if you give something and they will be come out through our biting and chewing process, then that is not a good materials. So think about the biting or chewing is the force. And this biting and chewing, when we are eating something with the dental materials present in our teeth, then they will feel some pressure, and that pressure is known as the force, and that pressure will have some changes within the materials. The reactions will take place. That is known as stress, and there will be have some changes will be seen on the materials. That will be the known as our strain. Now, if you look at here, there are three types of explanation we can tell. One is tensile stress, one is compressive stress, and another shear stress. So these will become like this. As for example, upper teeth and lower teeth, when they come, when we are getting the force like that, that is called the compressive stress. When we get the apart to each other, that is called the tensile stress. And when we get the surface rolling on the surface, that is called the shear stress. So these are the three different type of stress we can see on the material surfaces. Next is ductility and malleability. So ductility, that we are using different type of words in our dentistry, like for the orthodontic braces or any tiny metal sheets we can use. The ductility, it is the property of the materials which will help us when we pull it or tensiling forces we apply, they will not break. Without breaking, they will be stressed. And that actually known as the ductility. As you can see here, the measure of the capacity of a metal to be stressed or drawn out by a pulling or tensile force without fracturing. So we can pull a materials and it can make a being as a string, make a strings, and they will not break until that breaking point. That capability of the metal is known as ductility. Or you can say that due to the ductile property, we are able to make the tiny pieces of the wires. As you can see here, these are the metal wires can be possible to make due to the ductility. And on the other hand, malleability is the one which is the capability of the metals which can spread in all directions, which can spread in all directions. That means the measure of the capability of a metal to be extend in all directions. When we press, it can extend all directions. Is that so? It's called the compressive. That this type of property is known as malleability, and it can be done by a compressive forces. Now the next changes in the thermal change properties. Whenever we eat something cold, whenever we eat something hot, our teeth will respond. The change of thermal in the oral cavity resulting from the hot and cold productions. So our goal is whenever we eat something hot, the material should not be melt. Or whenever we eat something cold, material should not be shrink. If it is hot, what will happen? If it is expand, it will come out from the tooth surfaces. If it is shrink, it will make a micro gap between the materials and the tooth surfaces. So that's why the different materials, they will have been expand or contract at different rates. But we want a coefficient of thermal expansions. It should be the similar expansions. As I mentioned that whenever we eat something hot or something cold, our teeth will respond. And the same response we want from the materials also. If the materials are responding the same way, that means there will be no problem. But if the materials respond differently, like expansions or contractions, more expansions and more contractions, then it's a problem. Because think about you put some materials on the tooth, patient start to eat something like hot coffee, and the material starts to melt. Then that we want. That type of material we don't want. Our patients eat something cold and materials start to shrink that we don't want. So that's why the different materials expand and contract at different rates. But the gold standard, ultimate goal is tooth structures and the restorative materials, they have to, the contract and expansion the same rate of expansion and contraction we want. It means that whenever we eat something hot and cold, our teeth will also respond. It may be contract or it may be expand. So the same response we also want the materials what we put on the tooth surface. If we do not have anything like that, then that is not a good materials. That is called the response to the thermal changes. Next one is the electric properties. Electric properties, we call them, it also known as the galvanic actions. So electric current will produce. So electric current will produce when we are using the similar, dissimilar materials onto the tooth surfaces as the restorative materials. As you can see here in the oral cavity, it will take place when the two different or dissimilar metals are present. You know that in our elementary class, we know that we can create the electricity by using the two different materials with the water and the salt. Just give me 1 second. So whenever we have two different metal in our oral cavity, say patient has one restorations made by amalgam and one restorations is made by the gold. So gold and amalgam, one is silver, one is gold. And the patient's mouth has the saliva. And inside the saliva, what we have? We have the minerals. So this is actually indicate that how actually the electricity we can make. So two battery when they are in a liquid form and in the come up with the salt, they will able to produce the electricity. So same thing, if the patient's mouth contain the two different type of metal in the same side, say or upper 1/6, the first molar on right side has a amalgam restorations, and the 4/6, the same side on the right lower, they have a gold restorations. When the patients bite, they feel discomfort. And this discomfortness is due to the production of electric current. So this electric current is not able to use for making the any other purposes of electricity, but it will create some discomfort for the patients. So to avoid this discomfort, the main goal is we have to make the filling or restorations. If it is gold on this side, on the up, lower also need to be gold. If it is amalgam, the lower also be amalgam. We can put the gold here, amalgam here. There is no problem. But if it is same side, because when the patients bite, then saliva and minerals will come together, then that will create problem. That's why it is called the electric properties or galvanic actions. And electric current or galvanic actions in the oral cavity can take place when there are two different or dissimilar metal presence. Sometimes the patients come up, okay, I have gold on the top. Could you please gold on the bottom? Patient one, something like that. So in that case, we should not consider this one because the patient may end up with some discomfort. When the patient start to chew the food, they will feel the discomfort. Why they feel the discomfort? As you can see here, the conditions that allow this electric current, saliva contain the salt and the gold and a good conductor. So these conductions, these the two metallic components of different compositions and acts as a battery. And due to this battery, this will produce some sorts of electricity. And that's why it will be called the discomfortness for the patients. So that's why we should be encourage the patient to go for the two different or dissimilar is not the good way. It should be the same. It should be the same. Next properties is corrosive properties. Corrosive properties means it is the reactions that occurs with the metal when it is exposed to the corrosive products, such as the humidity, temperature, and the saline. Because our materials, they will be exposed to the hot and cold, the way the teeth exposed to the hot and cold. So when certain changes can be seen on the metallic restorations, and that actually cause the corrosions of the dental materials. So most corrosion include the surface discolorations. The surface will gradually discolored. These color discolorations is we can remove easily by the polishing procedures, but this will be the corrosive properties. So it means that when the materials or dental materials what we apply for the restoration purposes, due to the exposed on the oral environment with hot and cold, then they will be start to change their color. So this color change properties of the materials is known as corrosive materials. We don't want anything to be colored. Okay, this is called also tarnish. Because if it is discolored, then again they need to come to the dental office and they need to go for the polishing. They need to again extra pay some money. So that's why we don't want any materials to be discolored very easily. Hardness is a measure of the resistance of the metal or indentation, scratching, or the abrasions. So that is the another property of the materials. So we don't want any materials which is creating any kind of indentations on their surfaces or cracking or scratching. So we don't want anything like that because people will use this tooth when they come up with the restorations for eating purposes, for brushing. So we don't want to anything change while they are eating, while they are brushing their teeth. Solubility. Solubility means like think about you have a glass of water, and in that glass of water you put a salt and you put sugar and you put sand. So what you can see, when you start to mix the sugar can easily dissolve with the water. And after a while, you will not able to see any sugar in the water because it already dissolves. But when you are giving a spoon of sand, when you mix it, you will see they are mixing easily. But after a few minutes, you will see they will be sedimented. That means they will deposit it again on the bottom of the glass. That means sand is not soluble to the water. So that actually we want. We want the sand-like properties of the materials. That means we don't want the materials to wash away. As you can see here, the degree of which the substance will dissolve in a given amount of another substances. That is called the solubility. The material that dissolve easily in the oral environment is of limited use because it is washed away and leave the tooth structure exposed again. So that's why we want the materials which has no solubility or low solubility. The materials which is highly soluble, that is not a good materials. The reason is these highly soluble materials gradually dissolve in the oral fluid, gradually dissolve by the help of the saliva. Then ultimately, we will not see any remaining of the materials on the two surfaces. That's why we should not use any materials which is highly soluble. If it is less soluble, then it is better to use for dental materials. Now the next is the application properties. So application properties again depend on four things. One is flow, another one is adhesions, another one is retentions, and another one is curing. For the dental materials, uh, to have a specific mechanical properties, steps must occur in the application of the dental materials. So it means that the materials has to have a good flowing capability, flowing on the tooth surfaces. So if they are not properly flow on the tooth surface, we don't like that type of materials because materials, if you mix something, it is viscous. If it is not moving, then what will happen? It is very difficult to fill it with this or very difficult to work with this type of materials. As you can see here, when the decay means dental caries or the tooth loss is removed and healthy tooth structure is prepared to receive a permanent filling materials. This is the usual practice. First of all, when the patients come in, we have to remove the diseased part of the tooth. So diseased part means the portion of the tooth which is already demineralized or which is already destroyed by the acid attack from the bacteria. So first of all, we remove that, the restricted part. Then the dental materials must be applied. So and when we apply these materials, and these materials is not easily going through or not palleable enough to place in the preparations, then it is not a good materials. So that means we want the materials to be less viscous. What is the meaning of viscosity? Anybody, any idea? What is the meaning of viscosity? Viscosity means it is thick. Say, think about I gave you two glass, and one glass I give you water, and another glass I give you the honey. Now I told you, okay, can you just pull it down? If I ask you to pull it down, what you can see? You'll see that the water is coming very fast. Honey also coming, but they will come very slowly. Yes or no? Do you understand this one?
Yes.
Okay, so the reason is the honey is coming very slowly because if you look at the texture of the honey, it's very thick. It's not like very thin like water. So that's why the water coming very fast and the honey will come very slowly from the glass if you are pull it down. So that's why that is called the viscosity. So we want the viscosity like water. That means once we mix the materials, we want it to flow easily onto the tooth surfaces. If we mix something and you try to take it out and put in the patient's mouth, but it is coming very slowly, slowly, slowly. That type of materials we don't want. So that is called the less palleable. So that's why, as you can see, a dental material, they must be palleable enough to be placed in the preparations, to be placed in the tooth surfaces. Dental materials are designed to have a certain amount of flow of the for the placements, and this allows the materials to fill in the preparation of the tooth easily. So that's why we want the materials which has a good flow, because the oral cavity, it's a very complicated area. The reason we say complicated area, the reason is the materials, what we put in the patient's mouth, they are hydrophobic in nature. And the oral cavity itself, hydrophilic in nature. So what is the meaning of hydrophilic and hydrophobic? Any idea? Hydrophobic, what do you mean by that? What is the meaning of hydro?
Water.
Hydro means water, you're right. So hydrophobic.
Afraid of something, afraid
Yeah.
of water.
Phobic means afraid. That means here we are using the hydrophobic means like it doesn't like water. Okay. And hydrophilic means it love water. So in our oral cavity, usually our cavity is moist, right? It is not dry. If it is dry, we call the xerostomy or dry mouth. So our oral cavity is always moist because of the presence of what? Our oral cavity is moist
Saliva.
because of presence of what?
Saliva.
Presence of saliva. Because we have three pair of major salivary glands are here, right? Do you know the name of the glands? What glands produce saliva? And what is their name? Shiva? What's the name of those glands which give you the saliva?
Salivary glands.
The name. What are the name of the salivary glands? We have parotid salivary gland on both sides. We have submandibular and sublingual salivary glands. These are all the major salivary glands. And there are multiple or numerous minor salivary glands are also present. So those glands, they actually release the saliva through the duct. We call them the exocrine glands. So those glands, they release the saliva. So when our oral cavity always having the saliva, and the materials what we want to put in the patient's mouth, they don't like saliva. So you see how complicated the area is. So that's why our oral cavity is hydrophilic conditions, and we want something which is not like water. If it is come in contact with the water, they will not set. So it means that we need to isolate the two. We need to make some isolations. We need to dry the tooth surface temporarily when we apply the materials. Because we cannot make the oral cavity for a longer period of time to dry unless if we make the rubber dam isolations. If you do not do any isolations and you try to put the materials can be go, but it will come out easily. That's why you can see all the dental clinic, they pretty much use the same materials. Say, as for example, you went to Dr. Johnson, he put the materials to your mouth, and you also go Dr. Kelly, she also put materials in your mouth. The Kelly's materials stay for 10 years. Johnson's materials stay for 2 years. What's the reason? The reason is during the placement of the materials, the isolation is not properly done. That's the reason the materials come out very easily. Okay, so that's the reason we should maintain the proper protocol while we apply the dental materials, because materials, they're all same. They're all same. Maybe they have a different brand name. Some people maybe use the Japanese materials. Some people maybe use the American 3M company's materials. So that is different. But company is different. The material is same. But when it comes to the manipulations and application, that is also different, because everybody's hand is different. Clinic to clinic, it will vary. But if we follow the protocol for proper isolations of the teeth, drying surface of the teeth, then it will be lasting or long lasting, and they will be very close to each other. Next property is the adhesions. Adhesions means there are two types of adhesions. One is adhesions and another co-adhesions. So adhesion means like two dissimilar materials. When there is two dissimilar materials come in contact to each other, we call them the adhesions. Think about you are driving a car. Okay, you are driving the car, and in a rainy season, rain is falling down, and you are driving the car. What are you gonna do? When the rain is coming, when the rain is falling, what do you do while you're driving the car?
You put on wipers.
Huh? You don't drive? Nobody drive here? I think everybody drive, right? So what are you gonna do? Forget about the materials. I'm asking a question like you are driving the car and rain is coming on your windshield. What do you do?
You put on wipers.
That's right. So you put the wiper. So wiper is removing the water from your glass, right? So that you can see the glass is clean and you go forward. If the wiper is not working, you cannot move forward, right? That is a very common sense. So it means that the windshield made of glass and the rain is coming on the top of your glass windshield, that is the water. So the water and the windshield